I sat down with Allison Poole and had a conversation around pelvic health. And I hope in this episode, you not only take away the idea that it is more than just Kegel exercises, but that also it's never too early to start taking care of your pelvic health, that pelvic health physical therapists are out there, and it's a completely different experience than the traditional physical therapy that we think of when we think, oh, I need to seek PT. So I hope that you get that from it. Also, I am just so excited to keep having these conversations that kind of push through barriers or fears that women of our generation have. We don't like to talk about uncomfortable topics. We don't like to bring up things that might be embarrassing to us or a taboo topic as we were raised. And I hope that this conversation will help you have another more fluid conversation with your care providers in your area to really improve your quality of life. We don't have to brush things aside. We don't have to just say it's part of getting older. We really need to be focusing on not only what our quality of life is now, but what it will be in decades to come. So I hope you enjoy this listen.
Welcome to Women Mastering Midlife, where we dive deep into the rich complexities of womanhood in our middle years. I'm your host, Victoria Bird, pharmacist, certified women's health coach, and your guide on this transformative journey. Whether you're navigating perimenopause, thriving in menopause, or mastering midlife's many transitions, this is your weekly dose of expert guidance, compassionate support, and a judgment-free space to explore it all. So get cozy, hit that play button, and let's rewrite the narrative around this remarkable stage from being something to dread into a beautiful transition.
I am very excited to welcome Allison Poole to the podcast today. Allison is a physical therapist and certified women's health coach specializing in pelvic health, perimenopause, and menopause. She combines her 20 years of clinical expertise, compassion, and personal experience to help women thrive, moving beyond the hormone hacks so you can truly take care of yourself in a lasting, sustainable way for decades to come. She owns Koru Physical Therapy and Wellness based in Portland, Maine. So you are on the other end of the country.
Yes, other side.
I'm in Washington and you are in Portland. Thank goodness for technology these days.
Yes.
So thank you so much for joining me. Our time difference does make it, sometimes a little tricky to connect. And you are also an Integrative Women's Health Institute alum,
Yes.
as I am myself. So we've gone through the same training as far as the health coach aspect and some of their perimenopause and menopause courses. So I really recognize that, you have some of the same mindset that I do, but I have the pharmacy background and you have the physical therapy background, which I do not. And so it is great to have you here to help answer some questions for our audience, because I feel like there's a disconnect between, people who don't know and understand what a pelvic floor physical therapist or pelvic health physical therapist does and how important that can be to midlife while you're experiencing it or even preparing for it. So I'm so glad to have you.
Yeah, thanks for having me. I'm so happy to be here.
So for women that are coming into the midlife transition, what are some things that we as women need to be doing or noticing regarding our pelvic health in this transition?
Yeah, so I think, the biggest thing is that, the pelvic floor and pelvic health is just so much more than Kegels or, leaking with, a cough or a sneeze, which of course is something that a lot of women experience. But things that as our hormones are shifting, a lot of things can start to change, which we can certainly get into. And I think what I often say is like the things that you may have noticed in the past that you were kind of getting away with, maybe you had a little leak with a sneeze or, went to the bathroom before the jumping jacks during, boot camp, really start to kind of ramp up during this time. And the bad news is that these things do not go away on their own. And that's where, seeking out help for pelvic health, pelvic floor physical therapist can really help kind of nip these problems in the bud so that you can feel confident and do the things that you want to do without worrying about leaking or pain or prolapse.
So these are some of the things that you do see in a pelvic health physical therapy aspect. So what when a woman comes to you in the clinic, what are you usually seeing more often than not?
Yeah. So women will come to me for a myriad of reasons. So of course, we'll have like the leaking with the cough or sneezing or jumping or running. So that would be categorized as stress incontinence. So there's like some impact, some stress to the bladder and pelvic floor that is causing some leakage. But I also see lots of women for urinary urgency, or they're feeling like, oh my God, I know where every bathroom in town is because, they're going to the bathroom before they leave the house, when they get to work, before they hop on a meeting. And all of a sudden it feels like their bladder is running their life. Or they're finding that, they're on their way home and it's like, they don't have to go. And then the minute, they pull into the driveway or they put the key in the door, they're like, oh my God, everyone move out of the way. I need to get to the bathroom. And that's what we'd call urge incontinence. So there's a really strong urge associated with that leakage. But we also, I'll see women with pain. So pain with intercourse, pain, pelvic pain, discomfort, itchiness, pain to touch, pain with penetration. And that can be, of course, we're losing estrogen during this time, and estrogen is playing a huge role in not only lubrication, but also just general tissue health in that area. And so as that tissue thins, it becomes more sensitive, easier to, more irritable. And of course, that is not comfortable, on a day to day. But then of course with intercourse, and then, our brain is really powerful and says, ooh, last time we tried that, it hurt. And so it's anticipating that pain, and we can create kind of this muscle guarding and anticipatory pain kind of response. And so that's a big one. And I think a lot of women kind of assume like, oh, well, things just kind of dry up and, shrivel up
and die.
Yeah. And so like that part of us is like, oh, I guess this is it now. And it really doesn't have to be. And there's so many things we can do so that, women can have a vibrant, healthy sex life for as long as they wish.
Yeah. I mean, I'm 43. I'll be 44 in July. And so I'm on the early side. I guess I'm one of those blessed with, I'm an overachiever. I like to start things early. But women that are a little older than me or my age, when I say the words vaginal atrophy, which they're tending to go away from that. They're now leaning more toward GSM, which is a much more comfortable word, terminology. But, when we did say the words vaginal atrophy, they were like, what do you mean? Like it just dies. Like, and you see the jokes in the movies about women and cobwebs and all those things. And it's just an unfair realization, that you're just supposed to expect this to happen and be okay with it. So I think that, it's a needed part of medicine that women can recognize that they can seek help in this and, don't need to be afraid. I've heard women come to me in coaching that say they even have a hard time with wiping in the bathroom, like that it's uncomfortable to even touch toilet paper. And so those are things that affect your day to day. And so what are some things that women, when they're thinking like, is this something that I should go in and seek care for? What does that feel like to them or look like to them that they can recognize as signs and symptoms that this is an issue?
Yeah. So I really think like if you're kind of asking that question, like, things are feeling different, there seems to be a change, there probably is. And really, encouraging women to trust that sense and seek help. I think one of the, because of pelvic health, I think all of these questions are really sensitive. Leaking, pain with sex, prolapse. These things can bring with that some shame, and and often doctors are not always asking the questions. And so then women don't feel like they need to bring it up or should bring it up, or they're feeling rushed and embarrassed. So, really asking for help, seeing, your provider, or if you live in, a direct access state for physical therapy, you can go see a pelvic floor physical therapist first.
That'd be amazing.
Yeah.
in those lucky states, I did an education course for nurses and nurse practitioners about midlife health. And one of the things that I suggested to them was having that on their, the pre-visit, the questionnaire that you get online that you have to fill out, the 50,000 questions. Yeah. There should be questions about difficulty painful intercourse, discomfort or dryness, because women don't want to bring it up. We kind of just feel like we should just suffer with it. It's our lot in life. It's part of getting older, and we should just continue on. And I think that, giving women the voice to say, I have the right to ask these questions if my doctor won't, is so important. And to be able to seek out a pelvic physical therapist on your own without a doctor's order would be fantastic. So for those listening, they should check to see if they live in one of those states or they have insurance coverage that they should, that they could visit one without an order. So what are some things that are common reasons that women in midlife are sent to pelvic PT? So they do get an order from the doctor. What are you seeing from that?
Yeah. So, they're not, they're having those for all those symptoms. So if they're having pain, if they're leaking, if they're not able to do the things they want to do, they're wearing pads, and they don't want to be, so they're coming to physical therapy to, resolve that issue. And so when I'm, in most physical therapists, right, we're just talking and meeting that patient where they are. So what is their goal for their pelvic health? So is that I want to do jumping jacks, or I want to go to the trampoline park with my kids and not have to wear a double up pad? Or is it simply like, I'd like to, go 2 hours in the car and not have to stop twice, or sleep through the night without getting up to pee. So those are huge quality of life issues. And I think a lot of the women that I work with, we women, right, we tolerate a lot before we ask for help. Right. And it's like, I think a lot of women kind of get to this place of like, okay, like I am not sleeping, right? I'm getting up 3 or 4 times a night to pee. Now it's rolling into every other aspect of my life and health, and it just kind of snowballs. And so really, my passion, it's just like, and like you, it's getting this word out. Like you don't have to wait until the final straw. Like these are things that are really treatable and, can just kind of give you your life back, or be in a place where you don't have to wait till you're getting up 6 times a night to finally seek help.
So we've got the order from the doctor. We have the appointment. What are we expecting when we walk into the office? Because when I think physical therapy, I think of, the old person on the table with the legs, the knees that need to be fixed, or somebody walking and needing assistance. I don't think like this is what exactly do you do?
Yeah, you will not be in a big room. And I hope if you are, go to find a different place. You're in a big room with lots of other people. Yeah. So, for most, I can't speak for all pelvic health practitioners, but, in my practice, right, it's like I first chat with someone on the phone first before they even come in, so they can just get a sense, right? It's a personal issue. You want to feel comfortable with your therapist. And, so the first visit is a lot of, information taking, kind of really getting a great idea of, what are your symptoms? What are your goals? What are the things that you want to be doing? And, in my practice, I'm also asking like, are you sleeping? What are you eating? Are you pooping? Right? The huge driver of a lot of urinary symptoms is constipation. And one thing that pelvic floor physical therapy can help. So with bowel issues, not many people are talking about incontinence, urinary incontinence. No one's talking about bowel or fecal incontinence. Yes. So we're just getting a really good, history, teaching you about the pelvic floor, what it is, what's involved. And then we do an orthopedic evaluation first. The pelvic floor is a small part of our body. It's connected to the rest of our body. So we want to see how you're holding your body, how you're breathing, how you move, your strength. And so we do kind of an orthopedic evaluation first. And then we do, to assess the pelvic floor muscles, we assess them vaginally, so internally, without a speculum and without stirrups. And we're basically just assessing muscle tone, muscle strength, and muscle coordination. A lot of women have been told, right, since like days of reading Cosmo, right? Like I got to do my Kegels.
Yes.
And maybe their doctor is like having them squeeze during an evaluation, but really not actually testing their strength, or can they do one properly? A lot of them are like, I think I'm doing it. Is that right? Like no one has taken the time to teach them. So we want to see, are you able to engage those muscles? Are you able to relax them? Which is kind of more to the issue, I would say, for most women. And in that coordination, like, are they able to coordinate it with their abdominals, their breath, to really get a sense of what's going on? And then we also screen for prolapse. So bladder, uterine, and rectal prolapse, we can also assess that. So you're getting a really nice, thorough evaluation. The big asterisk or caveat there is it doesn't have to be on the first date, on the first visit. We can work up to that. I tell my patients, like, we take an outside in approach. So, we can work up to that if needed, and if people have, a history of trauma or not feeling comfortable, there's a lot we can accomplish without the pelvic exam.
Okay. Yeah. When you were talking about Kegels, it reminded me of that Sex and the City episode where they're talking about it at brunch and Samantha's like, I'm doing mine right now. And that's probably not what a pelvic floor physical therapist is actually going to be telling you to do. It's probably a little more in depth. It's good to know that it's also not a first date. Like, we're not going to go to third base on the first date kind of situation. Like,
right.
You can ease in if you're not comfortable. Some women, they're like, I've had children. I have no like, I have no shame or fear or any hold up, go on, check me out. And others, they need their time. So that's nice that, that you can take the time with someone. It's not just rushed, a rush.
Yeah. And someone who's like experiencing lots of pelvic pain, like, I can have a pretty good guess of what those pelvic floor muscles are going to feel like if they're all tense and painful already, right? So it doesn't help anyone, right, to go right directly to those muscles that are already tense and painful to begin with. And so really working on ways to get that nervous system and that person in a place, then we can just be much more intentional and strategic on, how we're approaching.
So, and it also sounds like a more committed relationship. It's not just a one visit or two visits and you're done. This sounds like this is a connection that you have with someone for quite a while.
Yeah. So, it really depends. I would say, I think contrary to lots of kind of traditional PT where, it's like, oh, I'm rehabbing from, knee surgery or, I've strained my rotator cuff. That takes, weeks, months of rehab multiple times a week. So again, not speaking for every PT out there, but pelvic floor is a little bit different where once we understand what's going on and giving you some things to be doing, we can really spread that out. And so typically I see someone, every other week for a couple of visits. And then it's like, okay, now you have these strategies. Now, I'm going to have you go out and do this for a month. And then we check in. So really, it doesn't take a really long time, even with women who, I saw someone recently who, had bladder issues for 60 years. Mm. And we worked together for one visit and she came back and she was like, I did all the things you told me. And like, all of the things are better. And, so it really, like, once women are empowered, mm-hmm. they can understand how their bodies work. What are the things that are going to be most impactful? They can make those changes and they don't need, months and months and months of PT. Okay.
So obviously our conversation is a very general conversation and yes. Women should speak with their doctors and get orders for their own personal physical therapist or pelvic floor therapist. But on a general note, if women wanted to do some exercises or something that they could do at home to strengthen their pelvic floor, given they don't have any kind of contraindications for this kind of action, obviously, mm-hmm. What are some ideas of exercise? See, I have that pharmacist brain in me of like, we need to cover all of these. What are some ideas of exercises that we could do in general to strengthen the pelvic floor?
Yeah. So, with kind of before getting into kind of strengthening, a lot of women don't need to strengthen their pelvic floors. A lot of women need to relax their pelvic floors, which may or may not come to much of a surprise for the world we live in. Our pelvic floor works with our deep abdominal muscles and our diaphragm. And so those three groups of muscles need to be able to work in coordination for, to have a good, strong core and to be able to keep us dry and also to relax, to let things in or out. So when we have weakness in, like, say, our abdominals, sometimes our pelvic floor compensates and works harder, for example. Or, women from a very young age, right, learn to keep their bellies, tight and sucked in mm-hmm. and are really good at holding all the time. And it feels very hard to let go. And those habits and strategies can actually cause increased pelvic floor tension. And I liken it to maybe ironically to a trampoline. So if you think of a trampoline, when we jump on a trampoline, what does the trampoline have to do first when we jump on it? It has to go down.
Oh,
it has
okay.
to stretch.
Sorry. I'm overthinking this. I'm like, wait a minute. The last time I was on a trampoline.
Right.
I've had 2 kids, and even though they were C-sections, I think my issue is the pharmacist of the 12-hour days where you had no bathroom breaks. And now my 40-something-year-old bladder and every muscle holding everything in is like on strike. So I don't even go toward trampoline. So I apologize. I'm like, trampoline. Let me think of the last time I've seen
your kid on a trampoline. So the trampoline has to stretch. Yes. It has to go down so that it can generate that force to engage. And so a lot of women are really good at holding, and they're actually not really great at relaxing. And we need both kind of range of motion. We need that muscle to lengthen, and we need it to contract. So that's why a lot of women are like, well, I do my Kegels, but it's not helping, because we have to figure out where are we at? Are those muscles actually weak, or are they actually having some, more of a lengthening issue? And I would say more often than not, I'm seeing women with trouble lengthening. And then that coordination, like they just don't know how to do a Kegel. Does that make sense?
Yes. It does.
So what I would say before even thinking about strengthening, we want to think about breathing. And through our breath, we can lengthen our pelvic floor. And so practicing a nice deep belly breath, thinking about inhaling through our nose, and even putting a hand on the lower belly kind of towards our pubic bone, and taking slow inhale into the nose and seeing if we can just get that breath to reach our fingers on our pubic bone and just feel our belly rise. And then exhale, feeling everything just kind of rebound or just come back in. Because a lot of people, when they take that inhale, they want to suck it. Mm-hmm. And so it really is this nice expansion on the inhale, and exhale, it all kind of rebounds. So almost thinking similar to that trampoline visual. So breathing is like huge. And that's where we start with everyone, no matter kind of what category they fall in, because that really is kind of the foundation for engaging. So we want to engage on the exhale. So that would be like my number one. If I could teach everyone one thing, it would be to breathe and connect that with their pelvic floor.
And I would love to see, I wish we had cameras of everyone who was listening to this to see if they did what you just told them to, because I did. I was sitting here like, I'm in jeans that are obviously too tight for this kind of breathing exercise, but I was thinking like push out as far as you can. And it did feel very relaxing. I did feel everything kind of just go at the end. So it was nice. Mm-hmm.
Yeah. So that really, it seems, so simple, but it's like one of the hardest things that I teach. And for a lot of people, it's not intuitive, but it really is it will help no matter what, whether your pelvic floor is a little bit tight and having a hard time relaxing, or it's a little weak, because it really works on that range of motion. And then from there, things that are really great for pelvic floor are squats. So squats are a great exercise. The stronger our hips and our glutes are, that feeds our pelvic floor. It's a super functional exercise. We do that all the time. The goal of, Kegels are really just finding kind of that coordination and that pelvic floor muscles and being able to contract them. But what we don't want you having to do your Kegels at brunch, and drinking mimosas or over in the corner. What we want is the pelvic floor to work with you when you're doing your squats, when you're lifting the kids, when you're at boot camp, where you don't have to think about it, right? Like it's just responding like it used to. And that's the goal. And that's really where pelvic floor PT is going to take you, from finding that pelvic floor and figuring out what you need to do with it. But then how do you transition to real life, and how do you get your pelvic floor to just work with you versus like this separate thing that you have to do 100 of, at the red light or something like that.
Yeah. So we went through the Women's Health, the Integrative Women's Health Institute coaching program. And so I know what the basis of that was. And I've noticed that there was a lot of physical therapists that complete this program. I felt like kind of an odd man out every now and then because I was like, gosh, I feel like I did the wrong thing. I feel like I needed to do physical therapy. But how did you come to the conclusion that that was something that you wanted to add to your practice? And what have you found that it provides you when working with clients?
Yeah. So I think, when we're dealing with pelvic health, I mean, in this, for lots of different things in physical therapy, but I would say for pelvic health especially, it's not just muscles, right? We're working with the digestive system. As I mentioned, bowel health is so linked to our urinary health. So our gut health, so that gut health. So really, expanding my practice into understanding better, right? Like digestion and all those different lifestyle pieces that contribute to our overall health. But it just is so integrated into our pelvic health. Stress is a huge, huge piece of pelvic floor dysfunction, especially kind of the pain, some of those pain, constipation, and even some of that urinary urgency. So that kind of that really upregulated system. And so really looking at, right, that person in front of you and kind of all of those factors that are influencing the nervous system, which is then of course playing a role in, manifesting in that pelvic floor symptom.
Yeah. And the process of health coaching itself in the way that we were taught, because there's a lot of quote unquote health coaches out there in the world. And they're trying to regulate the field of health coaching and have it be a registered profession, but you're still going to find many people on social media can call themselves a health coach. but based on the National Health and Wellness Coach Board, our program's accredited through that board. And so the program that we're doing is actually guided more toward understanding where the person's coming from and asking open-ended questions, not telling someone what they need to do necessarily. So how does that help you with getting to the bottom of how to help your patients?
Yeah, I think, really it's, meeting them where they're at, right? And not telling like, oh, you need to have this pelvic floor strength so that you can jump, right? Like if someone's doesn't care about jumping or running, like I don't care either, right? So like really meeting women where they're at. And then really, I think a lot of women that I work with, right, they know what they need to do. Obviously sometimes they need some guidance and some nuance. They know what they need to do. It's actually all the other things that they're doing in life and all the other stuff that they're carrying, both physically, emotionally, is at the root of why they can't actually move forward or implement those things. And so I feel like with health coaching, it's really allowed me to just like ask those probing questions to help the woman themselves who already know the answer, right? Unearth those answers for themselves so that they can really make that lasting change. And they're not kind of coming up against that wall over and over again, but they can actually like figure out what is kind of tripping them up. And so which allows them to move forward.
Yeah. And I can see that there's a succinct difference. My husband's an orthopedic surgeon. And so I've seen the physical therapy department at their practice.
Sure.
And so it is a completely different direction, pelvic health PT, because it is more, here's your diagnosis, you had surgery, you're going to have this many visits with the PT, this many weeks out of surgery, blah, blah, blah. Whereas this is definitely more, how can we get you to uncover like what you're doing in your life that's holding you up from helping yourself correct things that are affecting your quality of life.
And I think giving women, that, I think oftentimes like, oh, I'll just figure it out on my own. Like I should know how to, take care of this myself, and then they don't, which is super frustrating. And, you don't have to suffer, right? All of these things are, they are common. They are not normal. So, these are things that you can get help and, feel empowered to address and move forward and, just like not have your pelvic floor, right, running your life and just impacting every aspect of your life.
Yeah. I mean, if you're thinking about where the next restroom is and I will openly admit on this, with this conversation, I have literally knocked children out of the way to get to the bathroom inside because I've waited and waited. And then it's like, I can't, I'm taking you down. If you even think about looking in the direction of the bathroom when you walk in this house, like you're on the floor. I love you,
totally.
but you got to get out of my way. And so I think, knowing if you're hearing this conversation and you're like, wow, like it's been miserable for me for a really long time. It's not too late, but what are some things that we should be looking for and taking action on early so that we're not getting to the point where it's harder and there's more work involved? Like, what are some things we could do early on?
Yeah. Awesome. I think if you're noticing any changes or worsening or like, oh, this isn't going away on its own, just like, don't wait. You don't have to wait until you're wearing a liner or a pad every day. Like you don't need, if you're just, oh, I leak a little bit when I sneeze or when, at the end of a workout, like that's not normal. Like that can be addressed now. Mm-hmm. You don't have to wait to get so bad, like where you're just, wearing long t-shirts and black leggings, right, to run or work out.
Yeah.
So, the other thing I would say is, our vaginal tissue health changes and it can start in, early to mid 40s when things start to change. So you can notice dryness, burning, less lubrication, painful sex. So those are all signs that there's change going on in the vaginal tissues. That is something that you don't need to wait on. You don't need to wait until it's super painful or it's like that all the time. You may notice like, oh, sometimes during my different times of my cycle that's showing up. Those are changes that you can get ahead of. Localized vaginal estrogen is, supported by, North American Menopause Society as being really safe for about 99.9% of women. Mm-hmm. Of course, that needs to be prescribed by your doctor. It's localized. I have a colleague who says like, what happens in the vagina stays in the vagina. So it's not getting into the bloodstream. Yeah. But that can be life-changing. And I have another colleague who says like, when you're getting your colonoscopy prescription, you should just be getting a prescription for, your localized vaginal estrogen. You don't need to wait till that you even have pain, dryness. That's something that you can start to do before. It can be a true preventative treatment.
Okay. Are you seeing women that are taking hormone therapy, like they're on the patch, they take the progesterone? Are you still seeing that there is a need for local vaginal estrogen?
Yeah. And I would say, for some, I do have I have some clients who can't tolerate estrogen. Like they've tried it and they can't tolerate it for various reasons. I have other, women who are going through cancer treatment who it's just like not even, even though it has been shown to be safe, it's like, nope, we're not introducing any estrogen to this scenario. And then there, of course, are some women who are just hesitant. And so, there is alternatives. Hyaluronic acid is a really great alternative, a non-hormonal option. Needs a new name. Like when you say hyaluronic acid, like
I'm going to put acid where?
Yeah, it's moisturizer. It's the same hyaluronic acid that's in your facial moisturizer. So those tissues are just like all the other tissue in our body, right? It's getting drier. Like we need to, we're using anti-wrinkle cream on our face. Like we need to moisturize those tissues. And so that can be another great alternative. Or for a lot of women, like that's sometimes where they want to start. To say, oh yeah, let me see if this makes a difference. And sometimes that can carry them for a while and be enough. But, localized vaginal estrogen is kind of the gold standard.
Yeah. I also feel like there's sometimes this, like hormone therapy is going to just save us all. Like it's the answer to everything. You're going to get right. Your hormones, hormone replacement, and you're magically not going to have any other issues. Don't worry about your lifestyle. Don't worry about, the choices you're making with the food you're eating or the sleep you're getting or the exercises you're doing. And I think that, that's something that we also need to remind women is that it's also hormones are amazing and they can be life-changing for a lot of people. Some people can't tolerate them. Some people it's contraindicated and they need other options. but also it's not an end all if you're not making great lifestyle changes.
Right.
So.
Exactly. Yeah. It's so true. And I think that, I always say, like, I'm so glad that the conversation around midlife and menopause and perimenopause is really getting its due. But with that, of course, is coming, this onslaught of, hormones and hormone replacement therapy, and like it's life-saving. Yes. And right. It's like that conversation. It's so much more than the hormones.
Yeah. And all the products. Like they're flying at us.
All the products.
I mean, I know my algorithm is a little skewed. I do have,
same.
It's like if I don't have 50 ads for menopause in some way, shape, or form, then I must have reset something, but there's so many different products and there's so many different people trying to sell you things that you may not need, because going to, get some pelvic health, with a PT and get some exercises on board and have those conversations can be life changing. While you might want lubrication, you may not need the $75 bottle that this celebrity might be toting, or that this influencer is saying has saved their lives. I think there's a lot of desperation in women still, because we're only on the beginning of this conversation. I don't know if you feel the same way. Like it feels like it's exploding, but there's still so much we don't know, and that there's so many things that are contraindicating each other that I feel like we're at the beginning of the battle of getting this education and research done, but we're kind of in the middle of the battlefield. There's bombs flying over us. Like where do we even look, And so hopefully for the generations behind us, they will have such better care and they'll have better standards. And, when I was in pharmacy school, I graduated in 2004. So 20 years ago, I graduated pharmacy school. And I remember being in a pharmacy during when the Women's Health Initiative came out in 2002. And the dust that collected on the hormone pills on the shelves was amazing. But we never talked about it back then. Like when we were doing case studies on patients and we did full workups, even though we were just pharmacists and we aren't doctors, we would have to diagnose and make up a plan. And we never, my colleagues, if they're listening and they remember a patient case from 20 years ago, I do not recall ever having a woman with menopause. There might have been someone with Prempro on their list of drugs that we had to monitor for, but there was never a conversation around what this experience is like. So I'm happy that we're getting there, but I also feel like now it's just so confusing for women. So it's good that we're having these talks and that there's clinics opening and people are starting to figure out what's working. But you yourself have focused on perimenopause and menopausal women. So what are you doing in your practice, and what are you providing as a perimenopause and menopause focused office?
Yeah. So, offering, of course, the pelvic health physical therapy, and as well as, really, that kind of that midlife health coaching of really looking at the big picture and looking at whether or not you're decide to use hormones or not, or, it's really looking at all those lifestyle things, our rest, our stress, our nutrition, our exercise, and what that looks like now, but really how that's setting ourselves up to have a really vibrant, fun postmenopause, right? We want to, what we do now is just so impactful for down the road. And I think that, women are, as our parents age, people around us are aging, it is such a, it can be really eye-opening, right? Of I need to get moving. I need to, I want to do X, Y, and Z. I don't want to be in pain or have all these, comorbidities. This is a wake-up call, right? You're finally kind of get the kids on their own, somewhat.
Partially
and it's now I can take care of myself and I have a little bit more time. And so working on all of those things, but the first thing I really work with is women is where do you want to go? What do you desire? What do you want your life to feel like, look like? And then pulling in, right, those pieces of health and wellness. Because I think there's of course nuance, and there's certain things we can do that optimize our health and our hormones and how we're feeling. But really, most women that I work with, and I'm sure, you probably see the same, as most women know what they need to do, right?
Mm-hmm.
It's like actually creating that space so that they can do those things and not feel like it's just another thing on their to-do list.
Yeah. Yeah. Giving yourself permission to take care of yourself is a really hard thing for women to do.
Yeah.
And so I've found that once they start to unravel that and have that permission, then things start to come, there's always roadblocks and there's always the hurdles, but once you give that permission to yourself, it can be really life-changing. I did a pickleball clinic. I did a pickleball clinic last summer, and I was probably 20 to 30 years younger than the youngest person above me. And there was another Vicky, and she was the spunky Vicky. Like she was blowing me out of the water. She had to, slow down on tennis because of a knee thing, but pickleball, she was killing all of us. Like she was serving with a gusto. And then she was talking about how she paddle boards and she leads the boats we're on the water, and there's a crewing team, and she helps run those races and the sailboat races. And I was just thinking, wow, you just mopped the floor with me, and you're going to go out tomorrow and do all these things, and I need to go home and take a nap. And so I think it does really, you have to start to think about, what do I want to be doing then? Because I also see the other side of that, where there are women and men that have aged that I know that aren't aging well, and they have lots of ailments, and they spend lots of time in the doctor's office. And I don't know about you, but I don't want to retire and then be at the doctor's office like twice a week. That's not
right. Right. We want to be like pickleball Vicky and like doing all the things that light her up and, are fun. Right. I have a similar client who, like walks 7 miles a day, and she's doing Pilates and she watches her grandkids. And I was like, can I be you when I grow up? Like, this is like amazing. So I think exactly, it's like, what are we, really helping women see that vision and help, where are we going, right? Like, of course, we want to minimize these symptoms or avoid these symptoms if we can. But really, it's like, why, right? Where are we going? Like, what do we want that vision to look like?
Yeah. Because if you're on the tiny boat out in the water leading the crew boats, you don't have a place to pee. Like, you have to be able to go longer than, you have to hold it for a little while. And so that pelvic floor is quite important when you're on the tiny little boat out there. So one of the questions I like to end with is, what is something that you would say to the women coming up behind us? Like, what words of wisdom or sage advice for the women that are going to be coming up into midlife after us? What would you say?
I would say that you don't have to wait for something to go off the rails to, learn more about your body. I think that, and even when the younger women that I treat, like, they are much more educated about how their bodies work and their hormones and their cycles. But I would say, this transition can start as early as age 35. And so when we start to notice changes, it's again, like, trusting that we're noticing that, and that, like, our body is talking to us, and that we don't need to just brush it off as stress or your hormones or your period. It's like noticing those changes and recognizing them as it's your body just kind of talking to you, and explore that and see, are there things that you can do to kind of get ahead of it, so that when we come into midlife, we're getting closer to menopause. We're not like in the middle of that battlefield, right? We're already like, we're well equipped. We have our tools so that we can get to the other side, with ease and support, without feeling like we're alone and, oh God, like, you're stuck.
Yeah. I'm so glad we had this conversation.
Yes,
thank you so much for chatting with me. And I hope that women out there feel more comfortable with having these conversations and seeking help from pelvic PT or their doctors, if they have to go and get an order. And if they are in the Portland, Maine area, far away from where I am, then of course look you up, because it sounds like you have a wonderful practice where anybody who can come in there and be seen with you would have a wonderful experience. So thank you.
Thank you for having me.
Thanks so much for joining me today. We'll be back next week for another episode of Women Mastering Midlife. Until then, find us on Instagram at Women Mastering Midlife and join my free Facebook community, Women Mastering Midlife, to continue our discussions. If you have any questions that you'd like answered on an Ask Me Anything episode, send your emails to hello@missvictoriabird.com.